go.
Hi there, Doctor. Hi.
Hello there. Nice to meet you. I'm
Okay.
Dr Roylance. What can I do for you today?
Well, it was my brother, really.
Okay.
I'm a bit of an old boy, but my wife's only 35, and we've been married a year, and as you do, you start thinking about children, and just yesterday, my brother, who lives in Sydney, I rang up because we knew they were having a baby, and we were expecting lovely news, except that my brother rang and said that their baby had been born with Down Under syndrome.
Gosh, okay.
And obviously lots of thoughts spring to mind when you hear that. It was a bad line, and I couldn't, I could barely hear him. And then he had to go because the consultant was coming, I just thought I really needed to talk to you and find out a bit more, about the implications for us.
Okay. You mentioned lots of things spring to mind. You said that. What sort of?
Well, you think about, could it run in families? What are the risks of me passing it on if it does run in families? And even for my nephew, what does it mean? Is it something that can be fixed? Is it something that they've got to live with lifelong, or does it affect quality of life? Is there something, that we could do that might reduce the risk?
Okay, so there's a lot of questions there, isn't there? You mentioned you had a chat with your brother about it, and I understand it's a difficult time for him, it must be. But did he tell you any more information about Down Under syndrome or anything?
He said it was a problem with the baby's heart.
Okay.
The blood vessels weren't in the right position. But he was pleased because actually the Professor Down Under works at the Sydney Hospital.
Oh, that's good.
And so he's under the right specialist.
Line,
but the line was so bad we got cut off, and I can't get in contact. He can't have his mobile phone on in the hospital.
Yeah. Okay. And you mentioned you're worried about the implications for yourself.
Yes.
Sometimes when people are worried and thinking about things, they look things up on the internet or they read about things. Have you done anything like that to find any more information?
Well, I actually decided not to, because the problem is if you go Googling it can be really quite alarmist, and what I really wanted was to have a perspective rather than just get freaked out by it.
Okay. And you mentioned yourself and your partner are trying for a baby.
Yes, we are, yes.
That's nice. Are you actively trying at the moment? Are you using any contraception?
No. I mean, my wife's on folic acid, and we're not using any contraception, and just really seeing what life brings.
Okay. So your wife could get pregnant any time.
Yeah.
Okay. And you've mentioned quite a few concerns there. Before we address those, just a few quick questions about yourself. As far as my medical records say, you're fit and well. Is that right?
Yeah. I mean, I never come to the GP.
No. That's good.
Yeah.
For you.
Thank goodness.
And you also, in terms of family history, do you know of anything that runs in the family? Any problems with babies or anything else?
No, I've got my three brothers, and I mean, my mum and dad have died now, so I can't ask further back. But certainly nothing that springs to mind.
And have you got any other children from another relationship?
No, just
so
married late in life, as you do sometimes.
All right then. Okay, so that's good. And now you mentioned quite a few things, quite a few questions that you've got. So just quickly to recap, you wanted to know a little bit more about this condition.
Yes.
You wanted to know the implications for yourself and your partner should you decide to try for a baby.
Well, we are, yes.
Yeah, should you get pregnant and have a baby. And then you also wondered a bit about if it was genetic.
Yes, absolutely, yeah.
Are they the main things that you want to cover today?
Yeah, very much so, and that's about what's going to happen.
And about the prognosis for your nephew, obviously.
Yeah, because then my brother has got big implications.
And it's understandable to be worried about that. Okay, that's fine. We can have a chat about that. Certainly, but first of all, I need to be honest and say that I don't have much knowledge about this condition.
Right.
It's a very rare condition.
And my brother said,
and it's not something that we see as general practitioners often, or I've even seen before.
Okay.
So I think the first thing is that, I'm not going to be able to give you all that information, I'm afraid, today.
I didn't expect that it would be on off the tip of your tongue, because from what my brother said.
But that's certainly what we can do is, I can go away and look into this into more detail, and hopefully there'll be some things that you can do as well, and then we can come together, bring both of our, bring the information that we each gather, and then discuss it in more detail. So I can go away, speak to some specialists. It might be that I actually need to speak to this Professor Down Under in Australia to find out some more information.
Well, that would be very good, wouldn't it?
And also have a look in some, at some medical resources, maybe see if I can, if it even is possible to speak to people that have the condition, just to find a little bit more about the implications for yourself. And for your partner. And then if you could speak to your brother a little bit more, I know it must be a very difficult time for him at the moment, but if he could give you any more information, or if he could, even possibly email you some information from the professor, or anything extra that you can bring.
I think that'd be very sensible. I mean, he's not going to, at some point, I will have to get back in contact. I'm sure he's going to give me a ring in the next day or so anyway.
Yeah, that would be really good. And then we can meet up in a couple of weeks, 2 weeks' time. We can book an appointment today. We can both go away, find out this information, and meet up then. Does that seem like it would be something reasonable for you? Yeah,
it'd be really. I mean, obviously, I think that's a good idea. It'd be great to find out sooner rather than later. Obviously.
I also think it's important that because we don't know much about this condition at the moment, we don't know if there is a possibility that it could be inherited, if it could be genetic. I think you need to use protection with your partner just for the next 2 weeks until we find out for definite, because it might be that if it is inherited, if it is passed on through the family, we need to speak to a specialist before you try and conceive, to try and limit your risk of passing it on to your child. Does that make sense?
Yeah, absolutely. I mean, for the ones of 2 weeks, it'd be daft not to get some information.
And it's not about, it's just being safe, really. That's all. It's not, we're not sure yet, and I think we just need to be safe till we
I'd rather be safe than sorry, absolutely.
Exactly. So we've got a plan there.
I'll go in. I might actually go and find out if there are any support groups, because even if they're only down in Australia, you can email or Skype, can't you, and just find out about it. I might do that. I think that's a good idea.
Yeah, it's a good idea. And if your wife's got any questions as well, because obviously it's a joint thing between the two of you, what you could do is bring her to the next appointment as well, and then we could discuss it as the three of us together.
Yeah, no, I think that'd be a really good idea. So I'll book the appointments, and I'll bring my wife, and I'll do my little bit of homework, and we'll have a chat. Is that all right? Well, thank you, Doctor. I appreciate that.